Even as India recorded the highest spike of COVID 19 cases in a day with 1,752 cases on Friday, several districts that were once marked red zones are slowly making their way to the green class. Complete lockdown, effective distribution of essentials, and some innovative strategies using technology have helped 5 districts in the country to contain the spread of the virus. And with that, Maharashtra's Baramati district, Rajasthan's Bhilwara, Agra in Uttar Pradesh, Pattanamthitta and Kasargod in Kerala have set examples in battling the virus. Bhilwara model. Did you know that Bhilwara in Rajasthan became the first district in the country to stop new infections within a span of less than 2 weeks? This district in Rajasthan followed a ruthless containment strategy devised by the district magistrate Rajendra Bhatt.
भीलवाड़ा को हमें बचाना है, भीलवाड़ा से इस कोविड चेन को तोड़ना है और भीलवाड़ा से कोई भी बाहर नहीं जाए। आज भीलवाड़ा से करीब यदि कोई व्यक्ति किसी हिसाब से बाहर जाता है, भली परमिशन लेके जाता है, तो दूसरे जिले उससे खौफ खाते हैं कि ये भीलवाड़ा से आया। ये चीज 7 दिन के अंदर, इस 10 दिन बाद ये खत्म हो जाएगी। आप लोग अगर सब साथ रहे तो हमारे सारे केसेस यहाँ नेगेटिव से पॉजिटिव से नेगेटिव हो जाएंगे और एक भी केस नहीं बढ़ेगा। हम कोविड चेन को यहीं तोड़ेंगे।
After complete lockdown, the administration did door-to-door delivery of essentials to ensure no one breached the lockdown or social distancing rules. Around 3,000 teams of Corona warriors and Corona captains were constituted to reach out to 32 lakh people. Agra model. The Agra model has been hailed as the best model by the centre for its effective containment strategy. 1,200 teams were deployed to conduct door to door screening and reached out to 9 lakh people. Smart city command centers were used as war rooms to coordinate with frontline workers on the ground. Use of technology was maximized. Drone monitoring of public gatherings, mobile phone GPS, and CCTV cameras were used to identify movement of infected people. Baramati model. Baramati in Pune district had one of the highest number of COVID 19 infections in Maharashtra, but is now being hailed as a successful model. No cases have been reported in the city in the past 10 days, owing largely to its effective distribution mechanism. Local police, government authorities, and volunteers are working together to deliver essential items to residents with the help of a delivery app called Kirana. Apart from the app, residents also place grocery requests on WhatsApp groups to which officials respond immediately. The city was divided into 44 zones, and a police officer assigned to each zone would lead 30 to 40 volunteers and carry out these deliveries and household surveys to check for potential coronavirus cases. Pattanamthitta model. Technology is the symbol of success in Kerala's Pattanamthitta. After the first few cases were identified on March 8, the district borders were sealed and contacts traced. Not only primary contacts, but every single person who had entered the district was screened. Infographics showing the travel route of affected persons were created and published online. This encouraged people who may have come in contact with those paths to come forward voluntarily for screening. An app called Corona RM was used to survey those in home quarantine as their whereabouts could be tracked using the app. Kasargod model. The country's third case was identified in Kerala's Kasargod on February 3rd, following which the district had 169 cases with 0 deaths. Section 144 was imposed and 7 drones deployed for surveilling social distancing. The administration banked on aggressive testing, contact tracing, and public awareness campaigns. Care for Kasargod, an action plan where all essential items were home delivered to those in containment zones, irrespective of being rich or poor, was carried out. Break the chain. A public awareness campaign on social distancing became a huge hit and was adopted rigorously.